you so much for joining us this morning and coming to our webinar training on some of our United Way 2-in-1 transportation programs. So we'll talk today about some community level data. We'll share details about the two primary programs, Ride United Transportation Assistance and Project Dash. And we'll talk a little bit about how these services are currently functioning, some of the things, the lessons that we've learned over the past several years of operating them, and then also ways that you could potentially partner with us to use these programs to meet your clients' needs. So my name is Jill Bunge. I'm the Executive Vice President of Impact at United Way of Greater Toledo. I'm joined today by Emily Matthews, our 2-in-1 Program Manager. So we'll kind of be hitting back and forth to share this information with you this morning. So I'll start with a very brief overview of 2-in-1. I am being presumptive here and assuming many folks have some familiarity with 2-in-1. If you have more questions after this, we'll save those for the end, and we have tons more information on the 2-in-1 program as a whole that we're always happy to share. But in a nutshell, 2-in-1 is a free and confidential service that connects people with any health and human resources they need 24/7, 365. So we are part of a localized program. We cover 16 counties in Northwest Ohio, but 2-in-1 is across the country. So last year in 2025 alone, there were 16.5 million connections to resources made nationwide. And about 70% of 2-in-1 services are operated or funded in part by United Ways. And Ohio actually is one of only 2 states that does not get state support to cover 2-in-1. So we don't have full coverage across all of our 88 counties. But we have a very strong foothold in Northwest Ohio here. And as we said, we're available all the time. Folks can call us if they don't know where to turn, and we'll connect them with help. Primarily, the top resources that we're connecting folks to are your basic needs: food, shelter, utilities, clothing, transportation services. But we do some different things too. We have child or elderly care resources. Right now, tax season is very top of mind. We connect people with volunteer opportunities, some of those more intensive services like financial coaching or legal counseling. But we maintain a database of over 900 agencies, 3,500 programs. We're consistently updating these resources. So this is a very rich pool of resources in our community that we can connect people to, that gives them all the information they need on eligibility, hours of operation, so that we know that they can get the service they need on the day that they show up to request that. So I'm going to hand it over to Emily now. She's going to dig a little bit deeper into the resources that we have around transportation in 2-in-1.
Thank you. So 2-in-1 has so much more to offer than just a connection to resources. Over the years, we've seen that simply giving the information to callers, while it is helpful, can sometimes still leave them with a lack of ability to reach the services themselves. Lucas County relies strongly on our local public transportation providers, and together we've acknowledged that there are some gaps in service areas. So with the addition of our transportation and delivery programs, we've been able to close some of those gaps and not only get the resources to the people, but the people to the resources. Existing community resources. So we are aware, before diving into our Ride United programs, I just wanted to give you a bit of an overview of what calling 2-in-1 for general transportation might look like. So over the last 2 years of sitting alongside our local transportation providers in committee meetings, there are certain service gaps that have been identified in our community. So 2-in-1 resource advisors are very aware of what kind of resources exist in the community and what they're not able to find a local resource for. So as I mentioned, we have a strong reliance on TARTA, and many agencies have independent contracts with black and white transportation. Some of our major employers may offer shuttle services to get their employees to work, but we do find it rare. And Medicaid and Medicare providers are able to address the needs for rides to case management, food pantry access, medical appointments, often on a scheduled basis, so usually within 24 to 48 hours ahead of the appointment. But we are very aware of the lack of agencies and resources that are able to provide bus fare, long distance bus passes, general errand running services, shopping assistance, employment transportation, as well as door-to-door medical escorts. While we have curb-to-curb, we don't necessarily have many providers, transportation providers that can get the person back to the door or from the door into the vehicle. We're constantly tracking this public-facing information. If you're familiar with our 211counts.org page, you can find it, and if it is helpful to view yourself. So we track the amount of calls that we receive for transportation services alongside the amount of unmet needs in any given time frame, and you can go on there and filter all that information yourself if it's interesting to you. And here's some of our data where you can see the shift in our local transportation referrals and unmet needs from 2020 to the introduction of the Ride United Transportation Assistance Program in 2023. So imagine the grays as no's and the yellows as yeses. We not only collect the information requested by someone who contacts 211, but we indicate if there's a program available in the community that the person would be eligible for. So 2023 marked a significant expansion in transportation for us with the addition of Ruta. And anecdotally, I want to say we've seen a huge increase in this program and interest in this program, and several agencies reaching out about the transportation needs for their clients. So it seems that across the community, this is becoming an increased need. And you can see in 2023, 24, 25, we were able to say yes, we can provide that transportation so many more times than we were having to say no prior. But we do still have limitations. So now to pivot directly towards our two programs. Ride United Transportation Access began in 2023 as a partnership with United Way of Greater Toledo and United Way Worldwide. With their help, we were able to kickstart a program for our local community to reach their health and human service needs. So while there always have been parameters around the program, we've been able to offer 3,120 unique riders, so unique individuals, rides to their appointments as of about 2 weeks ago, which is very exciting. And Ruta as a program has very few limitations on the types of rides that they can provide. So here's an acceptable list of, in theory, ride use cases. So housing and shelter, food access, legal appointments, school, employment, health, doctor, dental appointments. But important, however, due to our current funding constraints, our local program is only able to offer rides to shelters, the warming centers, crisis centers, domestic violence, as well as currently to tax appointments as we're scheduling those during tax season. So the options for what rides we could do if we were partnering together are plentiful, but currently our list is a little bit short. So to give you a peek behind the curtain so that you understand how we book those rides, here is a quick video overview of the portal that we use. But I can't hear the sound.
We can't hear the sound either. You have to share it with sound.
Yeah, but I can talk over it. So basically, we just have the desktop version
All right,
of
let me fix
the.
that. It was that I was muted.
Okay. Good.
Here we go.
Lyft Concierge's courtesy ride platform makes it easy to send reliable, affordable rides to the people who matter to your organization, even if they don't have the Lyft app. Here's how it works. To start a new ride, log in on your desktop or mobile device and click Request. Then fill out your rider's info. You'll see the ride's price and distance up front. Need to message the driver? Add a note here. Send the ride right away, schedule it for later, or send a flexible ride that riders can request on their own. Choose the ride type that fits your rider's needs, such as luxury and extra seat options. And voila, your ride request is on the way. Once a nearby driver accepts the ride, your rider will receive a text message with everything they need to know for a smooth pickup. If your rider doesn't have a mobile phone, they'll receive an automated call to their landline with all the details. From your dashboard, you can track and monitor active and upcoming rides and support your riders. With Lyft Concierge, you can take better care of your people, simplify transportation management, and drive your organization forward. Log in to send a ride with Lyft Concierge.
Super. So that's the back end that we see when we're coordinating transportation and rides. But just to kind of give you a picture, Lyft has done a really tremendous job of resolving some of the challenges. And it also allows us to really be high touch with making sure that we're understanding what's happening with particular clients and when their rides are going to be arriving. So here's a quick overview from the last year of the Ride United Transportation Access Program. As we said, some of the types of rides that we're able to provide clients, those to shelter and housing, to hot meals and food pantry sites. We did have some employment specific funding that was grant funded that was exhausted at the end of June. We've also taken folks to places like JFS, the BMV, Social Security office, so that they can get critical documents and paperwork to be able to access services. And then we saw a big uptick in rides to warming centers as those opened up in December and have continued through to February. So our Ride United Transportation Access Program has many partnerships that we have kind of worked with that serves a variety of different clients. As Emily said, there's really a wide range of health and human services qualifying options for people to be able to take advantage of these rides. In the case of our previous and current partnerships, those are contingent upon the specific grant funding that we've been able to work with these agencies who have a client population that they're serving. So this is just a little overview. Emily, I'll give a couple little anecdotes about some of the other examples. But you can see here, we've worked very closely with Health Council to get some of their folks specifically to prenatal appointments and different engagement opportunities. We always pick up with LISC and tax prep appointments to make sure that folks are getting those. We're also doing that scheduling on the back end through 211. But really, we launched this program in 2021 at a kind of a reduced capacity, and we've really seen the expansion over the years. So we're excited to explore with all of you to maybe some additional options of other services that we could provide or how we can serve your clients.
So to highlight one of our longest partnership, we have been working with the Hospital Council of Northwest Ohio since the early days of Ride United. And with their help, we have been able to iron out some of the program processes, and it now works seamlessly for both of us by following just these few easy steps here. So Hospital Council has included 211 transportation dollars into their larger grant requests. If you have that ability, you can write us in and say that we'd be taking on that grant and doing that spend for you. So that funding would get transferred to United Way of Greater Toledo, and then we pay attention to the drawdown, use for your clients only. And then they've made it so easy on us. They just do a quick Google form with a sign-up sheet of who needs rides, and then they send it to me 24 hours prior. We can always adjust that process, but that's what's been seeming to work for both of us. And then one of my community resource advisors schedules the rides, and the rider receives a text alert. So there's very little communication that really has to happen between us, making it quite easy and seamless on both ends. And then we do the data gathering required for whatever grant reporting. So if you want to know how much you've spent, how many riders you've been able to transport, etc., we're able to report that back to you. So some of the example events that Queens Village and Hospital Council and Pathways Hub have been able to send their clients to are different mommy meetups, different educational events, support groups, health education, advocacy, and many other opportunities. Our favorite story there too is we've gotten 3 of their clients over the last few years to the hospital to deliver their babies because Lyft was going to be quicker than an ambulance in certain situations. So not a habit we get into, but a good story nonetheless. And then we have also seen a value in this transportation program that you really can't put a price on. So through 211's coordinated entry into 4 of our residential shelters in Toledo, we're able to confidently offer our unhoused neighbors a ride to a safe, warm place to land. As a direct result, more families are making it to their intake appointments on time and being housed, resulting in less no-shows for the shelter staff. And over the last few months, with an investment from the Toledo Lucas County Homelessness Board and the City of Toledo, we've been able to offer 357 rides to warming centers in the last 4 months alone. We have also been able to step in for Toledo Police Department and Fire Department in certain situations where we can provide the transportation to the shelter so that the officer can just move right on more quickly to the next emergency. We've also learned a lot of lessons with this program. We know that some folks in need of transportation have been unable to access this program for a handful of reasons. So due to personal barriers, such as not having a cell phone or familiarity with rideshare apps, can sometimes lead to missed rides or difficulty finding the driver, as well as being unable to, we are unable to transport unaccompanied minors, so folks under the age of 18 by themselves. We also recognize that this program may not be appropriate or accessible for those with mobility issues. Due to the Lyft app limitations, we can only offer the vehicles that they have available, which are not always accessible for people with disabilities. So understanding this gap, we continue to sit alongside our local transportation committees to advocate for greater access to transportation for folks that are living with disabilities. And we also find that the availability of Lyft drivers is focused in the higher density areas, so sometimes making it difficult for us to pick up riders in rural areas, though we can almost always get someone from Toledo to the outskirts. To go on to Project Dash. So the second of our transportation programs. So one of our newer partnerships, Project Dash is a program for transportation insecure individuals to receive health and human service related needs. And acceptable deliveries could include anything under the sun, really. So food, hot meals, baby, holiday supplies, durable medical supplies, and so much more. We've joined forces with a few local agencies to send out over 3,500 deliveries to homebound individuals in the last 2.5 years. And as you can see here, we have some incredible partners that are able to get a range of materials to their clients in need. By partnering for delivery services, the 211 Community Resource Advisors are also able to pair the individual caller's request with an agency referral that most makes sense for their other lifestyle needs. We know that if a person is in need of one thing, such as incontinence supplies, they may be in need of some other things that the Ability Center may have on hand. So by integrating 211 and using us as that starting point for some of the delivery services in the area, we're able to better refer appropriate clients to your agencies as well. So an enormous thank you to Greater Grace Christian Church, Brown Bag Food Project, the Ability Center, and the Pregnancy Center, who we'll talk about next. So starting in summer 2024, we saw an uptick in requests for diapers and formula thanks to a viral post on Facebook stating that 211 would deliver you diapers in under 24 hours. That was not our 211. It may have been one across the country that was also using DoorDash at the time. But due to those requests, we saw over 100 requests for diaper delivery in a week. So in order to reduce those unmet needs here at 211, we partnered for Project Dash with the Pregnancy Center. Since then, we've sent out over 81 deliveries to their clients and folks that have called 211 indicating that they have those needs. And they've made it really easy on us as well. So the Pregnancy Center simply just fills out a Google form. It goes right to our emails, and they prepare the delivery of their own resources. And then the CRA on our end for 211 schedules the delivery. The recipient of the delivery receives a text to let them know when it's going to be there. DoorDash driver picks up, delivers. And then again, similar to Lyft, we will do the data gathering and grant reporting that you may need.
Thanks, Emily. Yeah, I think that's an important point here too. Many of our partners, these are existing materials and supplies that they have that they're providing to their clients. We are the literal physical vehicle that actually gets those to the clients in need. Obviously, a couple of those, many of our deliveries have been in the realms of groceries too, but really thrilled about partnerships where we can expand some of those other necessary supplies for households. Okay, so while you're all here, how to partner. So I just wanted to give a little bit of a background on kind of how we have been operating this program to date. As Emily mentioned initially, United Way Worldwide, which is a separate entity from our locally operated United Way of Greater Toledo, had offered some grant funding to local market United Ways. So we were able to capitalize on that, begin the program in the COVID era, and then we've been able to increase our fundraising around that by pursuing separate sponsorships. So we've had kind of a good track record with that, 23, 24. Coming into this year, I'm sure as many of you are experiencing, there's a lot of challenges across the nonprofit sector in the fundraising space. We are still actively pursuing sponsorships to be able to support this program. But the grant funding we've received from United Way Worldwide has also declined. So, we're really trying to push a local effort to raise money for this program, to be supportive of it. We also want to, get the word out so that other folks and agencies in the community who are serving know that we do have this service that we may be able to provide to enhance the programs that you're already operating. So how do we do that? First, this is a large informational session just to give folks kind of a general overview of the capability, but we want to talk about what your specific needs are. What are you seeing with your clients? We know that there are limitations with transportation access, especially on-demand transportation access in the community. And again, with DoorDash, that people are not able to leave or have access to receiving the supplies that they need to their home. So we really want to understand your needs as an agency, the frequency or the density of clients that you may be serving. And then we can talk about your level of program engagement. So right now, again, due to our funding restrictions, we are asking for a cost share with our partner agencies who would be coming on board. So these are estimated cost shares per ride. Because of the low cost of living in Toledo, we actually are significantly under the national average for a Ride United Transportation Assistance ride, which is near $30. And then for Project Dash, again, this is an estimate around $8 a delivery so that we can, compensate the DoorDash driver and then that concierge service. So this is, again, kind of a baseline for what we want to look at. Because of the frequency of requests that we've had about this program, we are open to having a conversation about how this program could serve your clients. We don't have hard minimums for the amount of money that you have to bring in or the number of riders, but we want to make sure that meshes with the scale that our program is at so that we can continue to manage the program appropriately, deliver excellence of service, and that our community resource advisors are equipped to ensure that we're executing on our end of the promise with rides and deliveries. So then, if we were able to kind of arrive at, a good, strong partnership moving forward, we would sign just a very simple MOU stating the, roles of each of the agencies. We'll provide you with an overview and a training. Like Emily said, if you would need assistance in setting up a Google form or some other mechanism to be able to easily relay us information, or to have your case managers or your program staff be able to get that information to us about your clients, we would be able to kind of help you set up that system to ensure that information is transferred between United Way and your agency. And as always, just a note here, our commitment to client confidentiality is very strong. So we can also ensure that, those mechanisms are in place to protect the records of the clients. Of course, you would then provide us that information, and then in exchange, for instance, if you had some additional grant funding that required reporting, we're able to offer you a wealth of data about your riders, the nature of the rides or the deliveries, dates and times, things like that. So all of those generalized reporting requirements, we would be able to provide back to you to ensure that you could expedite any reporting needs, or just monitor the program in general and understand how it's best serving your clients and the frequency of utilization. So that was a lot of information in a short amount of time. We're going to be sending this recording out to everyone on the call today and those who registered. This will live on our website. But again, we are the human beings behind this service. So we want to talk to you all. We want to understand what your needs are and how we can best serve you. So we will now open it up for some Q&A, and you'll have our contact information sent as a follow-up as well. Are there any specific questions that we can get started with?
We did have one in the chat. So if there are any efforts in the near future to include Wood County and how can we partner? So I did say we have been successfully partnered with Brown Bag Food Project for 3 years now. As long as the person dials 211 before noon, Monday, Wednesday, Friday, they can receive a box of food that day and it would come after 5 p.m. or if they called any other day of the week, it would just be the following. Beyond that, we don't have Wood County partners, but we are absolutely open to it if you have anything that would be delivered. We find that with DoorDash, there is an availability of drivers even in the more rural areas. As long as there are restaurants around, there are pretty much DoorDash drivers. So, yeah, talk to us about it.
Additional questions, and you're welcome to take yourself off mute.
I have a question. This is Zach from Toledo Fire. As far as a Project Dash, do those individuals have to be established clients of any place, or can it be a cold call? We recognize that there's a need for something and they can have that form filled out.
Yep, you can just have them call. So if someone were to call 211 and say, "Hi, I need food delivered," we have only one other option actually in the Toledo area for food delivery. Southside Life Station has been really wonderful over the last few years, but they are the only other pantry that delivers. So we would try to assess whatever other resources they might have for food, but generally, no, we don't have real client eligibility for our food boxes that have to go out. For the pregnancy center, they call, if we get a call and they say, "Hi, I need diapers delivered," we would say, "Call the pregnancy center." And the pregnancy center does their intake form, and then it just comes to my email. So we have very little information about the actual client themselves. We just do the delivery part. So very little eligibility for both programs. We've tried to keep it as low barrier as we possibly can. Now, if your agency had something to deliver, that is entirely up to you, the eligibility of who those recipients would be.
Any additional questions?
I do have a question actually. I was actually wondering about the Brown Bag Food Project. Here at Angrady, though, as a Success Ambassador, we work directly with a lot of our employees. If we have a client or a employee in need, would we be able to actually reach out to you on behalf of them? Because I know some people are just not really wanting to really reach out on their own, though. They kind of get in that space, though, where they're almost ashamed of it. So we try to kind of act sometimes as a middleman just to kind of help.
Yeah, absolutely. Thank you for doing that for them as well. You can always call and ask for delivery, and we would get the person signed up, and you can call on behalf of someone else. We call to confirm that the person's going to be home to receive the delivery. And in that instance, you could either put your own phone number and we would call you back before the delivery was going to come, or you could give us the client's information and we would call them just to make sure they're going to be home. And then that person would receive the information about the delivery saying, "Hey, the driver just picked up the box. They're bringing it to you now. Hey, it just got dropped off." So either way, we do make a confirmation call just to make sure we're not sending a box to an empty house. But either way.
I definitely do appreciate that. Thank you so much.
Yeah, of course.
Thank you for the great questions.
Another question, Zach again.
Go right ahead, Zach.
I notice that there's certain times you were able to provide rides to different locations, and it seems like it kind of gets narrowed down depending on maybe on funding. There was a whole list of places that you said that you have given some occasionally. How would we know what places we can get rides to? Is that on the portal somehow, or would that take place just during the call?
As this is a program with an ever-changing nature due to funding, I would say probably the easiest way to find out the truth would be call 211 and just ask us, because sometimes, like for right now, we can do rides to tax appointments. But if you ask me in September, I'm probably not going to take you to your tax appointment. So it does change seasonally and based on what funding we have available. We right now are working very, very basic needs. So to the shelters and to the warming centers, to DV and crisis, to keep people safe. So our baseline is safety, getting people where they need to be. But you do have a point. So after midnight to 7 a.m., sometimes they have to reach out just for confirmation to be able to do the ride. Because since we're typically bringing people to health and human service places. Most of them are not open overnight. So after hours, they might just need an extra step of approval. And we do have a rule of not transporting someone that's unhoused somewhere just to be homeless there. So if we don't have a bed at a shelter or an open warming center, we might not be able to move the person at that time. So we try our best, and we'll try to figure out if there is a shelter, if there is a place to put them. But we don't just want to drop somebody outside Cherry Street if they're not going to be able to be let in that night. So we'll try to troubleshoot on the call. Typically though, yeah, give us a call and we'll let you know.
And Emily, are there any challenges, like at different times of the day with availability of drivers?
Availability, I'm gonna say no. Time of day, not usually. We can almost always find a handful of drivers in the Toledo area, even overnight. I have been surprised with some of these warming center rides getting called at 3, 4, or 5 o'clock in the morning. There are drivers around, so they've been pretty good. Sometimes, surprisingly, Maumee, Perrysburg, Swanton, some of the areas that are just a little bit further out, sometimes the availability of drivers is a little bit less there, but it works on it pings off their GPS system. So if we're requesting the rides, the Lyft portal on the driver's end is kind of going to start to bring people in that area since it's showing interest.
Super, thank you. Any additional questions? All right. We'll wrap up today. Thank you so much for attending, for your time and attention today. As always, we are here to have ongoing conversations, to give updates about availability of services. We would love to partner with you and talk about how we could, collaboratively enhance these programs to make sure that they're available to either your clients or the general public in the community. So thank you so much. We'll send follow-up information out and look forward to hearing from you soon.